A very warm greetings. We are from Group 5 and there are three members of Group 5, which are Ivy Tan Wen Yi, Joanna Christina John, and Leonard Anak Luang. Our group's topic is discuss the socio-cultural changes that affect the health of elderly in rural Malaysia. The contents of our presentations consists of introductions, points, and conclusions.
Hi, my name is Leonard Anak Luang, metric number 75372. Today I'm going to present the introductions for our topic.
Population aging is taking place in both developed and developing countries in the world. Globally, the number of persons aged above 60 years old is projected to increase from 841 million in 2013 to more than 2 billion in 2050. According to Tengku Aizan, Malaysia is likely to attain aging nation status by 2030, where 15% of the country's populations are aged 60 and above. On the other hand, the Department of Statistics Malaysia has estimated that Malaysia will experience aging populations in the year 2021, when the populations age 65 years and average 7.1%. According to United Nations, elderly or older people refers to the individual with the age of 60 years old and above, which have been mentioned in the United Nations World Assembly on Aging in Vienna. As well as in Malaysia, the National Policy on Senior Citizens define elderly as those who are above the age of 60 years old. However, Tinker stated that elderly refers to those who over retirement age, which is usually measured by the age at which a person is eligible for pension. In this slide, I will present the definitions of socio-cultural change, health, and rural. What is socio-cultural change? To understand the meaning, it can be divided into two parts, which are social change and cultural change. Social change refers to any significant alterations over time in behavior patterns and cultural values and norms, while cultural change is the belief that culture is symbolically coded and can thus is taught from one person to another, means that cultures, although bonded, can change. According to World Health Organizations, health is a state of complete physical, mental, and social well-being, not merely the absence of infirmity and disease. Next, IFAD stated that rural refers generally to areas of open country and small settlements, but definitions of rural areas in both policy-oriented and scholarly literature are terms often taken for granted or left undefined. In a process of definitions that is often fraught with difficulties. That's all from me. Now I will let my group mate, Ivy Tan Wen Yi and Joanna Christina Jones to discuss and elaborate more regarding our topic.
Hi, my name is Ivy Tauni, metric number 75080. Today we are going to discuss about the social cultural changes that affect the health of elderly in rural Malaysia. Okay, so let's continue discuss the social cultural changes that affect the health of the elderly in rural Malaysia. First, availability of healthcare, less access to medical care. Second, economic position, less income. Third, education level, less education. Availability of healthcare, less access to medical care. As the older adults, they are faced with a wide-ranging medical and care needs, such as cognitive impairments, mental illness, dementia, physical impairments due to arthritis, Parkinson's disease, and multiple co-occurring diseases such as hypertension, diabetes mellitus, heart diseases. As the absolute and relative number of elderly increases, it is only to be expected that the number of admissions of the elderly patients into the hospital also increase. More hospitals will be needed to be built and services which need to be introduced or further developed, especially in relation to the care of the elderly, would include rehabilitations and ambulatory and day care services. So, retirement homes will be ideal as they could live with their independence and at the same time have the company of their same age groups and be secure by the fact that professional helpers are always around nearby. Kuching MP Doctor Kelvin E reminded that healthcare ministry that greater investment into the public healthcare is urgently needed due to a lack of healthcare workers in the rural area. Of the rural clinics in Sarawak, he noted 98 out of the 215 do not have a doctor and are only run by the medical assistants and nurses, which could lead to burnout and poor quality of care for the patients. Second, economic position, less income. Lim and Complan, in understanding socioeconomic position have associated with the role of the socioeconomic position and one's health. In their context, one's income level is closely related to the healthcare accessibility. Elderly in rural Malaysia with lower socioeconomic position have lower quality of life, less access to healthcare, and thus have lower levels of overall health. Poverty may threaten the well-being of the older person who has limited sources of income. Majority of the older people are retired and have limited income. Their opportunity to work is highly restricted, placing them at a very low levels of socioeconomic status, which may increases their risk of mental health problems, especially higher among urban dwellers. Education level, less education. Older people with economic disadvantage may have poor cognitive function due to lower education level. Education levels and worsening health outcomes could be linked to a number of contributing factors, including stress and lack of job satisfaction. Nevertheless, increased education level manifests in significant health outcomes and frequency of contact with the health system in a rural setting. For example, older people with a high level of um, education will more concerned about their health by maintaining better healthy lifestyle and exercise regularly. In contrast, older people with low level of education will less concerned about their health and have less knowledge in maintaining their health.
Good day to the examiner. My name is Joyna Christina John, ID 75222, and today I will be presenting about the social cultural changes that affect the health of the elderly in rural Malaysia. Cultural changes that affect the health of the elderly in rural Malaysia is change in lifestyle. Lifestyle is the way that people live. Lifestyle has changed rapidly with each generation. The most important lifestyle changes for elderly including diet, alcohol intake, and sleep. Diet. As for the elderly, their taste and smell sense will diminish and poor dentures may limit food choice. They only can consume soft foods such as bread and porridge. Muscle mass loss begins around the age of 50, but accelerates after the age of 60, while fat mass continues to increase until about the age of 75. Muscle mass loss causes a decrease in basal metabolic rate. Living in the rural area makes it hard for the elderly to obtain the essential dietary supplies. Due to these changes in diet for lifestyle such as lowering of taste and smell sense, muscle mass loss, difficulty in obtaining the essential dietary supply, Elderly in rural Malaysia often got chewing difficulties, poor appetite, malnutrition, poor digestion, taste reduced, and dental disease. Alcohol intake. Sometimes elderly living in the rural area also taking alcohol due to loneliness, stress, and addiction. Aging can lower the body's tolerance for alcohol. Older adults generally experience the effects of alcohol more quickly than when they were younger. When the elder people change their lifestyle and becoming an alcoholic, they might face with certain health problems such as diabetes, high blood pressure, congestive heart failure, liver problems, osteoporosis, memory problems, and mood disorders. Sometimes, elderly insisted to take an alcohol for a day. One glass a day won't kill you, but more than that is not recommended. Sleep. It is common for older adults to experience changes in the quality and duration of their sleep. Many of these changes occur due to changes in the body's internal clock called circadian rhythms. Changes in production of hormones such as melatonin and cortisol may also play a role in disrupted sleep in older adults. As people age, the body secretes less melatonin, which is normally produced in responses to darkness, that helps promote sleep by coordinating circadian rhythms. Mental and physical health conditions may also interfere with sleep. Conditions that commonly affect sleep in older people include depression, diabetes, anxiety, arthritis, and heart disease. Poor sleep quality for elderly in rural Malaysia can be related to the lifestyle changes, which lead to high blood pressure, diabetes, and heart disease. Lifestyle is a manner of living that reflects individuals' behavior, attitude, thought, and beliefs, regardless the improvement in health service. Maintains healthy lifestyle is mandatory to live a healthy, wonderful life. Mae West once said, "You only live once, but if you do it right, once is enough." That's all from me. Thank you.
To conclude, socio-cultural changes play a vital role in how health is experienced, especially among the elderly in rural Malaysia. Apparently, socio-cultural changes such as less accessibility of medical care, less income, less education, and changing in lifestyle in terms of diet, alcohol intake, and sleep affect negatively towards the health of elderly. The World Health Organization states that with the growth of the elderly populations, there is an increase in many new social, political, and economic challenges. Therefore, the government may intervene and develop strategies and implement policies or laws to ensure that older people are treated fairly and with respect. For instance, there is family obligations towards the care of older people enshrined in law in China with punishments for adult children who fail to support a dependent parent. Hence, this will guarantee that the elders can and do live a better quality of life because at the end of the day, they will have contributed to the society in which we now live. That's all from Group 5. Thank you.
We got history. Got me feeling the nostalgia when you look at me. Thinking about what could have happened.